3 News.
A vaccine could soon be coming to Champaign County, but it's not going to be for everyone. And if you're banking on a negative coronavirus test to give you the green light for Thanksgiving, think again, because experts say you could still put others at risk.
And you could call her Santa's helper. How one woman is helping kids have a Christmas.
You're watching your local news leader. This is WCIA 3 News at 10.
We are hoping and praying for the vaccine to come and actually make an impact.
The Champaign-Urbana Public Health District is preparing for the first delivery of vaccines to arrive in December. Good evening. I'm Paul Cicchini.
And I'm Jessica Coons. This comes as Pfizer and Moderna are trying to get emergency authorizations.
A third company, AstraZeneca, announced today it's had successful late-stage trials as well.
WCIA3's Jen Lask is following Champaign County's vaccination plan. So, Jen, you asked how many doses Champaign County could end up getting.
Well, Jessica, there are still some big questions now and big unknowns, like whether a combination of both Pfizer and Moderna vaccines will be sent here or just one of the companies' vaccines. But what officials do know is that they are still going to need everyone's help getting through this winter because hospitals' resources are being stretched thin.
Our community is currently planning for limited vaccine delivery in December.
Across the country, Pfizer says as many as 25 million doses could be delivered next month. During a news conference with Champaign County's Emergency Operations Center, I asked CUPHD Director Julie Pride how many of those doses we can expect here.
That's the thing. I could do a press conference the day before the vaccine is delivered, and by the time it's delivered, it could change.
What Pride can say is who will get the vaccine first.
Those are going to be people who have direct client care, so the people who work in emergency rooms and ICUs and in the hospital and convenient cares and things like that, including people who don't necessarily provide direct health care, but are exposed to people in those areas.
Carl's chief associate medical officer says hospitals here are already preparing for the vaccines to arrive.
We've gone out and already start securing freezers for one of the vaccines that will need to be maintained at minus 80 degrees in order for it to be stable enough to be administered.
So, what comes next before the vaccines can roll out in central Illinois? Both Pfizer and Moderna's tests show they're about 95% effective, and AstraZeneca also shows it's effective and potentially cheaper. But still, it's going to take a lot more than the first wave of vaccinations for the country to round the corner when it comes to COVID.
If you have a highly efficacious vaccine and only a relatively small 40–50% of the people get vaccinated, you're not going to get the herd immunity you need.
So here's why health officials are focusing on vaccinating employees first. Sick hospital employees aren't able to come to work, so just having a bed in the hospital isn't enough. Now hospitals will need to report on the number of empty beds that can be staffed and ready to use within 4 hours. Availability and capacity, including staffing, will be reviewed on a daily basis. And in Region 6 right now, which includes Champaign County, there are just 1 out of every 3 beds available in the ICU. Public health officials here say they could be forced to make some tough decisions if the number of cases keeps rising.
A lot of people end up coming here if their healthcare facilities get overrun, but also because, we have our mitigations and everything we do, we are tied to our entire region.
Because we do feel an obligation to be the safety net, we will accept them if we do have the resources. The challenge will be when we are short of resources or potentially out of resources, how do we deal with that at that time? And we're having ongoing discussions that include even ethical questions.
Some hospitals have called from hours away asking for help, and doctors are still urging people to continue masking up, Jessica, practice that social distancing, not only to keep yourself healthy, but also the doctors in your community who might be called upon to help you if you become sick.
Absolutely. They certainly have a lot to worry about. All right, Jen, thank you.